Hi, I'm Kim Izzarelli, and welcome to Insights with Kim Izzarelli. Planned Parenthood, for some, is an icon of the 70s. It's a place to go for birth control. But today, Planned Parenthood has taken on a whole new meaning. It's an advocacy group for women, women's health issues, and a network throughout Westchester County, Rockland, Putnam, and Suffolk counties. Today, I have Reina Schiffrin, President and CEO of Planned Parenthood Action Fund and Planned Parenthood Hudson Peconic, which operates 11 health centers across those counties. And also, I have Carol Lemus with us here today. Carol is Director of Education and Training for the past 2 years for Planned Parenthood, and she will talk about some of the advocacy programs that the organization promotes. Thank you both for being here today.
Thank you.
So as I said, it's really been quite a change in the organization over the last few decades. What has that meant to you?
Well, first, I want to thank you for having us today.
You're quite welcome. My pleasure.
Have the viewers listen to us and hear about Planned Parenthood. Well, Planned Parenthood Hudson Peconic, it is our 80th anniversary this year. So we began in 1933 with our Mount Vernon Center, and they were run by volunteers. So over the years, Planned Parenthood has grown tremendously. Nationally, we're almost 100 years old. We are the 20th largest affiliate of 74. So there's 74 Planned Parenthood like us all throughout the country in every state, including Alaska and Hawaii. What has changed is that I believe we look at ourselves as a three-legged stool. We are not just a physician's practice, a big practice. Instead, we absolutely do medical services, the full range of reproductive health care. As you were speaking, we'll talk about that. We also have education and training programs in the community and schools, and we do advocacy to make sure access to reproductive health care continues in the state and the country. So we've grown to be a very, very large organization, and I always like to remind people that Planned Parenthood does more pap smears than any other practice in the whole country, and people are always kind of surprised by the preventative care we do.
That's amazing. So how many employees would be here in the counties that work on
we have 11 health centers, as you said. The closest ones to here, for this community, by the way, are in Brewster and in White Plains. And we have about 175 employees.
Wow.
From physicians to call center reps. We have a call center, educators, trainers, public affairs staff, of course, computer people. But the majority really do work in our 11 medical centers, because that's what we're about.
And how many patients or clients would you say that you serve?
So last year we saw about 33,000 patients.
That's amazing.
And did over 66,000 visits, which is quite a lot.
It is.
And those patients range in all ages. I like to tell people that. The majority of our patients are 20 to 29. Again, some people think we only see teens. Absolutely not.
Right.
We see women over 30. And we also see men, again, a little known secret, particularly for HIV testing and STD, sexually transmitted diseases, testing and treatment.
So that's a huge service for the community, because I would imagine many of these people would not be able to afford the care that they're receiving. How are you compensated, or how are the services paid for?
The majority of our patients, over 75%, and I hate to get technical, are under the federal poverty level of 200% or below. That means a family of 4, about 35,000. So 75–80% of our patients. We turn no one away, and that's what's different about us. We say care no matter what. And some people pay by insurance, Medicaid, sliding scale is what we do, and I'll talk about that. And of course, free, depending on your income. So we turn no one away. We are funded by the state and by local grants, foundations, and primarily also by individual donors.
Okay, and let's just talk a second about, you brought up pap smears, cervical cancers and things of that nature. I mean, that screening is so important for people, women, to get out and get that care and get those tests done. I mean, outcomes really do improve if you have an early intervention. So what's sort of your message out there for women? What age should they be sure to get in and see you if they haven't already?
I'm going to have you talk in a minute about what we do in the community. Our cancer screening program is very, very large, and that's particularly breast health, exams and PAPs, right? Cervical cancer. We do something called colposcopy for women, which if you have a bad PAP or something, a physician will view your cervix, do a biopsy. So that's really our cancer screening program. It really depends on when you become sexually active in terms of the age of when these tests need to be done and what the physician requires. We love to see young women. We see so many young women today coming with their mothers, fathers, friends to get early. I would say 17, 18 years old is really when young women want to come and begin to have those services of preventative care.
Right.
Certainly breast health, we find many, many women that then need a mammography or other later stage issues. So it's critical about doing breast exams. In terms of the community going out and speaking about cancer screenings and prevention, I think every age you would?
Every age. We start. The majority of our programs are in high schools. We do go into middle schools. We've even gone into elementary schools. We also work with parents extensively. We have a program called Let's Talk, and we actually have a training coming up in May that people can look to our website and register for. But it's focused on how do you talk to young people about issues related to sex.
Right. And it's so important. I think I read somewhere that it's a very high percentage of the population have HPV, and that of course can lead to the onset of precancerous conditions, and so this screening is so important. And I think back, a generation or two, how many women lost their lives very early. Even my mom's generation, women that didn't even live as long as I did from breast cancer or cervical cancer. So it's so amazing that we now have this technology and this ability to have the early screening. So,
and a vaccine, the HPV vaccine is amazing that we offer for young women and men. I think it's from 11 years old or 10, thank you, to 26. But you can have it, that's really what the FDA recommends. It's 3 series. And now we're also giving them to boys. You do need parental consent for a vaccine. And we are very happy to do that throughout the 4 counties, and there's no reason someone shouldn't come. It's a very expensive vaccine, but we can get most children into the Vaccine for Children program if you cannot afford it, which again, going to your physician, it's quite expensive, so we really would love to be doing that. But HPV is on a huge increase, as you said, chlamydia and gonorrhea. And chlamydia test leads to infertility, and HPV leads to cancer.
Right. So, and I read recently too that even though we do have the vaccine now, people still aren't going to get their kids vaccinated. I think the vaccine, the series has to be within a 6-month period of time. So you kind of have to think through how you're going to do that. But very important, particularly before they become sexually active. So that's exciting, and thank you for that work. What are some of the other questions that you're getting from students, from teens? What kind of conversations do you have? What are the...
Well, we talk a lot about really communication, decision-making skills. We talk about healthy relationships. So it's not just, we do go in and do presentations regarding contraceptives and sexually transmitted diseases, but we also talk about the related issues. So the kids are really thinking about when and if they're ready to become sexually active, how to have a healthy relationship with a partner, and really the whole integral aspect of what it is to grow up and start dating and.
Am I ready for this?
Yeah. So. It's not that we necessarily go into every school and every program. We go into mostly the health classes, but we talk about a real broad range of issues that are related to decision making.
It's great, and I think it's great that we're having the open dialogue, and even parents like myself that grew up in the 70s, it's still hard to have those conversations with your kids. It really is.
And many of the children don't want to hear it from their parents. I can talk about my own daughter.
Don't go there.
Right.
Too much information. But, I'm glad it's a healthy dialogue, and we need to have it. Now, Planned Parenthood has been very effective in advocacy for women. What are some of the issues that you're championing right now and you see on the horizon that you're excited about?
Well, we're really excited about the Governor Cuomo's bill here in New York State, the Women's Equality Agenda. And it has 10 points. It is not only about reproductive health, but there is a section about reproductive health decisions, but it's also about pay equity, human trafficking, domestic violence, really protecting women. And we're working in a huge coalition statewide and regionally. So we would love to see this bill written and passed in this session, and that will really, for us, codify Roe v. Wade in New York State and assure that women in this state and families, men and women, have the choice and can make the decision that really fits into Roe. The New York State law was written before Roe in 1970, so think about how long ago that was. And two main things that we really would like to see change is right now, termination abortion services are in the criminal code in New York State and must be moved to the health code, right? It's public health.
Right.
And the other is, at this time, I think you'll be surprised, in New York State, as you go later term, a woman can only have an abortion if it is, her life is in danger. By Roe, it can be her health. So all we want to do is change that in New York State. If a woman has a health issue, that she will be able to make that decision.
So the difference would be if the mother is physically becoming sick or might not be able to have a child again after, would that be the difference between life and health?
Well, her health, so if she has diabetes, something that is really dangerous. So diabetes is an example, something that's very dangerous, renal failure, that she
could give her complications later, or could be
during the pregnancy
fatal.
Or later, that she can make that, not only that her life is in danger. So we're working on it. 7 states, or 9 states, I believe, have this law. 7 states already have these reproductive health laws. And we want to see New York get ahead of the game and be, again, the leader in such rights for us, protecting a woman's rights to choose.
Well, I'm very interested and very sensitive to it, because I see a number of physicians leaving OBGYN or in gynecology. We're facing a physician's shortage in the state, and you're absolutely right. You know, to move this to the health code is the right thing to do. I don't think physicians should have to experience that kind of criminal pressure. I mean, it just doesn't belong there. It's wrong. So what are some of the other aspects of the legislation that you're advocating for?
Well, certainly pay equity for women, and it's really about transparency, that I'm allowed to share my pay with you, women, and there's some companies that is not allowed, so we can look at that. Stronger laws on human trafficking is very important. Not housing discrimination. If you've been a domestic violence victim, you know, right now landlords can choose not to give you a lease. And pregnancy discrimination in the workplace. So there are 10 points. I would have to pull them all out for you. And we have a huge coalition working on it, as I said, from reproductive rights people, but labor and businesses. Right now, over 500 organizations have signed on, and individuals, and we love to see more people sign on to the bill. And have the governor, he's leading it. I think we need the Senate and the Assembly to agree to it. And we're working very hard, educating them right now. Phone banking, canvassing both to the senators and to our community, to constituents.
And I should mention too that this is being taped on March 27th. So maybe by the time it airs, it might actually be passed.
Well, I think once the budget is done, I think you're 100% right.
So
the legislature will be able to focus on such a bill. But you know, I wanted you to talk, when you were talking about teens, if you don't mind, about education, to talk about our teen peer program, because I agree with you. A lot of teens and young people don't want to listen to us. Their parents, older people. So we have very successful peer education.
A large program in Rockland County. We currently have a group of 35 young people primarily from high school, who are going through a 15-week training, and it's a total of 30 hours of training to become reproductive and sexual health educators. So what happens is we go into the school, and when we do presentations in the schools, the peers come into the health classes with the educator, and the information is then not just coming from some old person, but coming from somebody their age.
It's peer-to-peer.
Peer-to-peer, plus
Yep.
their resources within their schools. So that when we're not there, the young people have questions or concerns or want to know how to access services, the kids are right there and they can be accessed. They're wonderful, amazing, committed kids because they really get no compensation for doing this. And they participate every week. They're coming to this training and very excited about it.
It's great. It's great. And I think pregnancy rates are going down among teens. Is that correct? I read that someplace recently. So it's the effort that's being put in, which is, you know, peer-to-peer. That's who they'll go to for information, right? They're not going to come to you or me. They're going to go to their friend. So.
Last year they reached close to 1,500 kids.
Well, that's amazing.
Right, and that was we had a small group last year, only of 7. So now we have 35. They're going to really multiply that effect.
And they also go online. I was thinking, so I think peer-to-peer, and then so our website, I think you have it, is www.pphp.org. But when you go into that, there are fact sheets for teens, but there are also ability to chat. It's really through our national office, and I've seen heard some of the tapes, and you would, in the middle of the night, teens are writing questions from menstruation, you know, what to expect, to a boyfriend pressuring them, and have a live person that is answering them. And I've seen notes like, "Thank you, you've saved, you know, my life almost," and tell where you can go for help. I think I'm pregnant. So they do that, and it's fact-based online. We also have a wonderful Smart Wheels. I'm thinking all the ways we get out to teens.
Right.
We have 2 mobile vans that do education and also do some testing. So here in Westchester, we do HIV testing.
HIV testing.
But it's a beautiful van if you haven't seen it. It has English and Spanish.
Right.
And we have an educator, and sometimes we bring on a clinician. And where do we go? All different places.
All over. We go where youth congregate. We go where recent immigrants congregate. We target the populations that are least likely to come into our centers and take the services to them.
Great. And I think HIV is another example of a success story where, with early intervention, you know, and diagnosis, and people taking the cocktail, I guess, they can have a normal life. And,
but it's early.
That's it.
Right.
That's it.
Right. And all knowing your status. And so the test that we provide on our Smart Wheels van is a 20-minute test. There are no needles involved. It's an oral swab, and it develops over 20 minutes. We can give them their results right there.
That's fantastic.
And the service is provided right now for free in the community.
Confidential, free. So we are, you know, we're delighted. We actually almost can't keep up with the demand of people asking for us to bring a van to them, to different groups. And it's really, as you said, for populations who will not come in, and those are some very high-risk populations.
Sure.
We've gone to shelters where women, you know, need to come on and, you know.
So they will probably not get the care anywhere else unless they have an interface with you.
Exactly.
So I know a lot of people will be interested in supporting you and how they can help fund your effort. So would you like to give a shout out as you're being prompted by Lynn here?
Well, last year, you know, we say to fill the gap, for us to be able to provide services in 11 centers, to do education and training, we absolutely have to fundraise. And last year, $1 million of fundraising really went to, if you want to call it, to charity care. As I said, there's a sliding scale, and you can be free, you can pay $20. So we raised over, you know, $1 million to do that, to help us. And we have wonderful events, now that you mention it, special events. The first one coming up in this area is in Rockland. And it will be at the Hook Mountain Bathhouse.
Right.
On June, in Nyack, am I right? On June 6th.
So
we do fundraising, for example. And
you got to get the right date, because you don't want a bunch of people to show up at the wrong place.
Nyack Beach, and you know, it's a wonderful event, and we cultivate people, and we raise money, and we do raffles. We have a fantastic event on Memorial Day weekend out in the Hamptons. So we do a lot of events, and that really helps us. And then we have individuals who certainly, from small donors who come online or through mail to major donors, and foundations. We have a thrift shop out in Huntington, which is terrific, and it raises funds for us too, very important. So without private funding, we could not, absolutely not, provide the services. And we're very fortunate to be in 4 counties that have a lot of very generous people who really believe in us and want to see Planned Parenthood continue. Particularly with healthcare reform coming, we believe that our doors are going to be knocking us down because women who never had insurance and did not come for care, and there are many, many women who are not coming today. They're feeding their children, they're buying gas, and the last thing they do is take care of themselves. Once they become uninsured, we believe they will be flocking to us for preventative care. So that's so fundraising is really important.
And have you found with the economy that people have been out of work, and that's also brought a new population of folks that may have had insurance before or no longer?
Great question. We saw 16% more patients in 2012 than the year before. Our numbers, and we're seeing more again this year. Women and men who are unemployed and no longer have insurance are coming to us, and we're only too happy. So the population, people coming to us, is absolutely growing, and we hope many of those people will go on insurance, but many won't, including the undocumented. They will not be part of this healthcare reform, so they need to have care and a place to go. Our numbers are up in every service. I want to say something. We do prenatal, you didn't remind, in 6 of our centers. And again, last year we did over 800, or I think about 700 patients doing many in deliveries in all different hospitals. And again, that's a population that really needs to come in early. And so the risks are
nutrition counseling and
social worker, we have nutrition counseling. And we see a lot of young women and older women for prenatal, in the closest center from here is in White Plains. Very, very busy service.
Yeah, I read recently too, it's a group between, I guess, 44 and 55 of women that are the first to find themselves out of work. I mean, there were maybe, I know for myself, I took 11 years out to raise my children, then I went back to work. That's the first group or the first population that gets let go because they're the least experienced, the last person on. So, yeah, it's great. It's great that you're there. I see here, Reina, you are responsible for largely for the capital campaigds. What did you build or create with the money that was raised? And thank you very much for all that work.
Well, I'm very proud of that. In my time, we have either built or relocated 4 health centers in all different counties. So when you come into our health centers, I love giving people tours, particularly legislators, because they're so surprised that we look just like a private office and not clinic-y. So we have 4 new centers in my time. We also have a call center that I'm very proud that I raised funds for. So all of our calls go to the center now, and it is out in Smithtown upstairs, and it's much, much better for our clients, so we can look online and give them the earliest appointment and plug them in. Another great campaign was our electronic health records, which was very, very major, and that cost us over $1 million to raise, that we are now totally electronic. And again, for the patients, that's terrific, because you go to Patchogue, or you can go to West Islip, or you can go to Spring Valley, and we have your record. And most recently, our campaign was for a new Smart Wheels van that we just raised about $200,000 to purchase and staff a new van that will be going out to Suffolk, particularly on the east end of Long Island. So I'm very proud of these capital projects. In addition to what we raise funds for day to day, we want to continue to grow our facilities and stay state of the art in terms of our equipment. And that's all capital. So Smart Wheels is our newest, and we're purchasing it as we say. It's being designed as we speak.
Put together,
Put together, a new shrink wrap. It has to be very attractive. And we love when we're driving. I have to say this on the Long Island Expressway. The staff tells me, people honk and they're, faint. It's a magnet for people to come in and ask, and teens or adults, and ask questions.
Well, we have about 5 minutes left, but you raised the legislature, and I think it's really important that people understand how important it is for them to talk to their legislator about supporting you and the work that you do. So what is the best way for someone watching this to say, I think this is really important, because frankly, if the legislator doesn't hear from you, they don't know what you're thinking. So what should they be doing?
First thing they can do is come online and sign up for our action alerts, okay, on Planned Parenthood. And once you sign up, we're going to be sending you things when things happen. Like yesterday's terrible new law enacted in North Dakota to restrict abortions to 6 weeks and do some other really terrible things. So we're going to alert you about that.
Okay.
And then you have the option to just electronically, you know, in that case, send it to that governor, but here, send it to your senator, an issue that's happening here. Electronically, your assemblyman, your senator, and it's going to match who it is for you. We love you making phone calls. You've come with us. We go up to Albany several times a year, actually, to we call it, it's not really lobbying, it's really educating.
Right.
And our legislators love to listen to us, and they love when our teens come, particularly, and our staff, because they really want to hear what it's like. So coming up to Albany, we do in-district visits too, which I love to do. You know, you are their constituent, and they do have to listen to you and see, you know, make sure you have a voice. We're the voice for our patients. Unfortunately, for many of our patients, we are their voice. So we need people like you and your viewers to come with us and do that. But emailing and phoning, we do phone banking, is very, very effective. Writing letters, just them hearing from you that you believe in this.
And I think that online contact is so important because of the timeliness of it, but it takes maybe a second or two to just say, yes, I agree, here's my name, my address, boom, it's gone, it's fought for you where it needs to go, because through the zip code, I would imagine, can tell who the constituent is, and you've helped in a second or two, and that's all it takes.
That's all it takes.
Okay. Well, I'm just going to give you the last, minute and a half to sort of make a shout out for anything coming up or anything that you want to be sure to mention or let our viewers know about. So I think we got all the dates. June 6th was okay.
May 26th.
May 26th.
Those are people who go out to the beach in the Hamptons.
Oh,
it's a great event on a Sunday. I think one thing we didn't talk about is a fantastic prematuris program, similar to peer educators, and why we have that. Could
we actually have two programs like that. Reina talked about foundation funding, and they're both supported by foundations. They're community health worker programs. So we have people who are key leaders within the community who also get trained in sexual and reproductive health. We have a group of Spanish-speaking individuals here in Westchester and Creole-speaking individuals in Rockland County who've been trained, who go out, can do presentations, they connect people to care, and they're a wonderful group of people. Again, these are people who are not getting compensation, and they're giving up their time to help people access our services.
Very good.
I know what I want to send it a picture. We need volunteers always. We have about 100 active volunteers, which may sound like a lot, but we have so many needs. From stuffing envelopes to going to health fairs, to learning to do education, working on public affairs. So again, if you go on our website or you dial our number, 1-800-230 plan, am I saying that right? Plan. You'll speak with someone, and internships. We have lots of students who want to come and work. We need people who can write. So volunteers.
So it's a great way for someone to fill their community service requirement.
Yes.
Many students have to do that in the area.
And we get a lot in the education department. We have a number of them.
Good, good. So you heard it, folks, today. You know, you can write, you can call, you can donate, you can show up at the events, and it'll all go to a good cause and help the people who need it. So I really appreciate you tuning in today. Thank you, both my guests.
Thank you
very
very
much for the work you're doing. Have a good week. See you next week.